Chloroquine is a chemical that is used primarily in other countries to treat malaria, but chemical derivatives or cousins of chloroquine, such as hydroxychloroquine, are used more commonly in the United States to treat autoimmune disease such as rheumatoid arthritis, for example. Chloroquine is also used to help treat fish parasites and is available as a powder to put into fish tanks. The chloroquine in the fish product is the same as the chloroquine used for medical purposes. However, the chloroquine used for medical purposes is measured out, for example, in a tablet form that you know how much you're getting, whereas the chloroquine that's used for fish tanks is essentially a powder that you may not know how much you're getting because the measurement isn't as precise, and there may also be other chemicals in the compound. Chloroquine and relatives of chloroquine, such as hydroxychloroquine, have been on the market for a really long time. Their use for things like COVID infection is much newer, though, and we don't know much about it. But we do know about these medications is they have what's called a narrow margin of safety, meaning that there's a very small difference between what a therapeutic dose is versus a toxic dose versus a fatal dose. And what we know about chloroquine poisonings in the past is that people often die very quickly from abnormal heart rhythms. And the other thing that makes it so dangerous is we don't have a good antidote or treatment for it. Chloroquine and medications like chloroquine are safe when they're taken as prescribed. However, once again, there is a very little margin of error between what is a therapeutic dose and what's a toxic dose. So we recommend that these medications be used only under the supervision of a medical provider. One of the other concerns that we have is that there may not be enough of these medications for people that need them. There has been a significant increase in demand for chloroquine and hydroxychloroquine, and there's also been a need for people that are using it to help treat COVID infections. So we are worried that people are trying to get these and use these in an inappropriate manner, which will not only compromise their safety, but may cause shortages that may harm people that need this medication as a treatment.